yield arrow question for USMLE related to cardiovascular system. And the question is, if a patient is given valsartan, which is an angiotensin receptor blocker, so what would be the direction of arrows for the following? Number one, renin, angiotensin 1, angiotensin 2, and number 4, aldosterone. So either they're going to be in down arrow direction or upward arrow direction, or they're not going to change. So think of the direction of the arrow in your head and give the answer. Direction of the arrows would be renin up arrow, angiotensin 1 up arrow, angiotensin 2 up arrow, and aldosterone is a down arrow. What's the reason? Angiotensin 2 receptor blockers, they're going to block the angiotensin 2 receptors, and angiotensin 2 is not going to function, that is, it is not going to cause the vasoconstriction, it is not going to cause the activation of the aldosterone system, and it is not going to increase the thirst activity, or it is not going to stimulate the thirst area in the brain. So these are the function of the angiotensin 2, right? And it is not going to cause the secretion of the antidiuretic hormone for the reabsorption of water. So all these uh, parameters would change their direction. So first of all, angiotensin 2 is not going to function, and the receptors are blocked. It is not the conversion which is blocked, right? So it is important to mention that uh, angiotensin converting enzyme inhibitors, they inhibit the conversion of angiotensin 1 into angiotensin 2. So if you give ACE inhibitors, that is angiotensin converting enzyme inhibitor, it is going to cause an up arrow for angiotensin 1 but a down arrow for angiotensin 2 because it inhibits the conversion. But in this scenario, ARBs, that are the angiotensin receptor blockers, they are going to block the receptors and not the conversion. So both angiotensin 1 and angiotensin 2, they are going to increase, they are going to be in the upward direction. So it is very high yield, and this is very frequently tested on the board exams. But angiotensin 2, it causes the stimulation of the aldosterone, and if the function of angiotensin 2 is blocked, it is not going to stimulate the aldosterone. So the arrow direction for the aldosterone would be in the downward direction. So aldosterone is decreased, and when the aldosterone is decreased, it is not going to cause fluid retention, it is not going to reabsorb salt and water. So there would be a kind of hypovolemia. So this would stimulate the secretion of renin from the JG cells, and it causes the forward or upward direction of the renin.